Kyle.
Hi, Dr. Aggarwal. That was pretty easy.
Good. I'm glad it was pretty easy. You could do an audio or audio and video call. So we're kind of fortunate that we're able to do both with this setup that we did this way.
So this is telemedicine.
Yep, this is telemedicine. So you can do audio only, or you could do audio and video.
Gotcha. And so this is something that you're going to be offering your patients here.
Yep. So we are offering telemedicine as of last week, and we've had a couple patients call in, both audio and one audio and video with a gentleman who had a bleeding vessel on his leg. And so I was able to see it. He was able to show it to me, and we were able to treat him and get him proper care so that he wouldn't have to go to the emergency room for something like that.
Mm-hmm.
And so it was kind of cool to be able to do something like that.
So this is obviously something that a lot of doctors' offices, I think, are adjusting to, but
Yes.
you're pretty familiar with. So when somebody calls you, what can you do? You can diagnose. You can you have all the privileges that you could have in the office. I'm assuming, right?
Sure. So with the pandemic, a lot of Medicare has sort of put out a statement saying that, and all insurance companies, if not all of them, have said that they will consider covering telehealth services because they are a different billing code and a different point of service code and things like that. And so this way we can communicate with our patients without actually having to see them in person and risk them coming out of the home at this time. And so we're able to talk with patients. If they have the capability of video and they're not on a flip phone or something like that, we can then visually see what their concern is, whether it's a varicose vein, an ulcer, a possible infection. Of course, we can't listen to your heart and lungs with this or anything like that, but for things that need to be checked visually, we can definitely help and then determine if they need to be seen in person or not.
How can a patient do they have to sign up for this, or is this something that how can they?
Yeah, so most physicians, in the country, are creating these accounts for their patients through different modalities. So we're using doxy.me to provide telehealth services to our patients. Other electronic medical record companies are also providing similar platforms to their physicians so that their patients can log in. Some practices have already had telemedicine as an ongoing service for their patients. And so the platform isn't the same for everybody, but it should be a capability for most patients to have a telemedicine visit.
This process really was pretty simple on my end. All I know is you sent me a text message with a website link, and then I just copied and pasted that link into my browser on my laptop, which I'm talking into right now. And here I am talking to you. Can you explain that process for us?
Sure. So I have the capability through this platform to send a text message with the link to my patient. I can also email the link to my patient, and then they would just click on it so that you initiate the video call or video and audio or audio only. There's multiple different options there depending on what your internet capability is, what your telephone or laptop capabilities are at the time that you're clicking onto that link. So then that link sends you into a virtual waiting room, and then that alerts me on my end. I get an email saying, ding, somebody's in the waiting room.
I heard it.
Yeah. So then I click in, and then we start the call. And depending again on connectivity and availability, we can do either video or just audio.
Yeah. And as we know, like everybody is at home, everybody's streaming and using internet for things like this. So, even though this call has been pretty good, there could be a few hiccups, but hang tight, right?
Right. So it's just be patient, just like with any internet-based connectivity right now. So many people are using it, like you said, and so it's going to be a little bit bogged down, I think. But it's still going to be available and work pretty good for patients, especially for those who really don't want to go out and, they're elderly. I think this is a really nice solution for those folks.
Yeah, I mean, you've done this in the past, I'm assuming, right? And this is
Yeah, so we just added this as of last week due to the pandemic,
okay.
but we've been aware of it. I think insurance companies generally are kind of hit and miss in terms of covering telehealth. So a lot of patients do pay out of pocket, usually $60 to $80 for a telehealth medicine visit, but they're able to see Kendra, our nurse practitioner, or myself. We are able to bill this out through insurance because all of those restrictions have been lifted for right now. We can then prescribe medication and call in something for somebody if they need it, or if they need a refill on something, or they just want us to look at this and say, hey, do I need to come in sooner rather than later, or I'm worried about this. So I think it's able to do a lot of multiple things for patients in this time. But even going forward in the future, I think this is a great tool for us to be able to give our patients down the road.
Mm-hmm. Yeah, I'm sure for even people with compromised immune systems, I mean, that peace of mind knowing that they can have access to a doctor just like this from the comfort of home is a great thing.
Yeah, I'm excited to use it for our patients, and I look forward to what it may evolve into after this as well. And I think we're going to see a lot of patients actually utilizing healthcare delivery systems very differently.
Yeah.
And so I think it's going to be interesting to see where this all goes.
That's wonderful. Anything else you'd like to add?
No, I think this is important for patients to realize that telemedicine is here. I think it's going to be here more prevalent. I think we're going to see more physicians in our community use it. I think, if you can utilize it to get the care that you need in the comfort of your home, I think patients should use it. I mean, you could even use it when you're on vacation. You're a snowbird and you're sitting in Florida, and your regular doctors are here in Lima, and you're like, I need a refill on something down here in Florida. I think it's something that patients can utilize from really anywhere in the world.
That's a wonderful point. And I think, as you mentioned too, I think once we're through this, it might be a new normal.
Right. It might be a new normal. So.
Right. Well, thanks very much for your time today, and I hope this is great for you. And it was very easy on my end. So.
Great. Well, thanks for allowing me to show our patients how they can get access to us.
You're welcome. Have a great rest of your day.
Thanks. You too.
Thanks.